There's
Yes.
that triple aim: access, quality of care, and cost, right? Having nurse practitioners that look like patients they serve and having that higher scope of practice, what does that mean for increasing access to patients more broadly?
Yeah, so there's literature that shows that folks of diverse backgrounds, when they get the higher level of education, they go back to their communities to be of service. That's critically important because
Hey everyone, welcome once again to Medical Practice Success Secrets. I'm your host, Theo Harvey, co-founder of SensorMed. I'm super excited to have a great guest with me today, Dr. Danielle McCamey. How are you today?
I'm doing great. How are you, the real Theo Harvey?
No one ever said it like that, but thank you for saying that. I appreciate it.
Yes, I love
Great
it.
meeting you. Thank you so much. We are thrilled to have you on this podcast. One of the things that we saw was your experience, over 20 years of nursing experience, outstanding leadership role, really focused on diversity, equity, inclusion in healthcare, and your insights really kind of guiding a lot of nurse practitioners and really kind of your whole organization, DNPs of color, is really instrumental in kind of guiding individuals through that journey, right, of their
Yeah.
career. So,
Mhm.
so thank you for your time today. What we like to do is just get right into it. I think
Let's
one of the
do it.
things that I'm just super curious about is we kind of look at your background and kind of, what you've been focused on in several years. Studies have shown that mentorship increases retention and job satisfaction among healthcare professionals. How's your work with DNPs of color impacted the professional journeys of nurses of color throughout the years?
DMPs of Color is an organization that, I feel like we're just a large epicenter of mentorship. And a lot of it is organic mentorship because there's different generations of nurses in the group. And folks at this level having their advanced degrees understand the value of mentorship to get you from point A to point Z. And so with our organization, we've been able to create formal mentorship programs and also informal mentorship programs, because what happens is when nurses get their DNP degrees, it affords them access to higher level jobs and expanded opportunities within the profession. And so a lot of times it's new territory for folks, or they might be the only one because they're a person of color. And so having that mentorship helps them get the game secrets on how to navigate some of these spaces, and also serves as a system of support. So to ask questions in a psychologically safe environment that's low stress, and then also just helping them to be able to rise to the challenge of the DNP degree affords them access to, with influence, access to different tables of opportunity. So as an organization, I like to say we are literally sustaining professionals in this space of nursing at this higher level of advanced degree and also higher level of leadership, influence, and impact.
I love that. I mean, obviously, scope of practice is important and
Oh,
increasing
yes.
that. And so basically providing even more care to the patients. My wife is a nurse, so I'm familiar with,
Oh,
and she's an
great.
RN. And so she's looking at, advanced degrees and that, and I think
Yes.
it's what's driving her is really she wants to do more for her patients, right? And that's
Yes.
really what you guys are focused on, which is
Send her
huge.
our way. Send her our way. We'd love to have a conversation with her.
Awesome, awesome, awesome. And you talk about access, right? We think about healthcare broadly. There's that
Yes.
triple aim: access, quality
Mhm.
of care, and cost, right? And so having nurse practitioners that look like patients they serve and having
Mhm.
that higher scope of practice, the higher level of where they can treat the patient, what does that mean for increasing access to patients more broadly? Can you speak to that?
Yeah, so there's literature that shows that folks of diverse backgrounds, when they get the higher level of education, they go back to their communities to be of service. And so that's critically important because, you think about a nurse going back to get their advanced degree to be a nurse practitioner, where nurse practitioners have the ability to close some of those gaps in care to provide high quality care and also access to primary care. And so when we're going back to the communities, we're helping to uplift the health and the wealth of those communities because we're bringing that knowledge and having that expanded scope of practice. We're able to provide them the care that they need. So that's a critical point because of us wanting to go back to be of service. And then just the literature broadly also supports that having a diverse healthcare workforce helps to close some of these healthcare inequities that we see. What those mechanisms are specifically haven't been well defined, but there is literature that shows folks that come from historically racialized, marginalized backgrounds tend to have the ability to have an expanded capacity in taking care of people from all backgrounds, and tend to have, I want to say no bias, but some degree of less bias when taking care of people from different backgrounds, which is interesting, but definitely critically important to help save lives.
hmm Yeah, we talk about this on this podcast a lot, like that patient to doctor or clinician communication
Yes.
channel has to
Mm-hmm.
be so tight. And, really it's about having a way to kind of communicate the testimony, right? Like, where is your background and how does that relate to the
Yes.
patient? Understanding, getting to the truth of the matter, right? Of like
Yes.
what's really bothering them. And
Mm-hmm.
then understanding, being transparent with them and clear. And so those 3 T's, communication, I mean, you kind of hit that when you talked about like having, individuals with, based on the literature, helping close those disparities because they're being transparent, they're being,
Mm-hmm.
truthful, and they're actually sharing their testimony. And so patients can reveal more and you can help them more, right? And I think that's
Absolutely.
always a challenge in sometimes marginal
Mm-hmm.
communities, right? Because
Mm-hmm.
the trust factor is so low in some cases with
Mm-hmm.
these institutionalized companies and organizations, especially in healthcare. I think that's so key. When you kind of look at, the literature and the understanding, like, well, really one of the things that way we found you, let's be honest, is using social media, right? Which is
Uh-huh.
this new platform, right? That's communicating not just to other clinicians, but also directly to patients. As a clinician and who's on social media more broadly, can you talk about that and the importance of using social media for the positive side, right? We saw a lot of misinformation, unfortunately, through
Listen,
COVID. But what does that mean for you being out there on the social media?
one thing, from COVID with the misinformation, but also society leaning more on utilizing social media for connection and also disseminating information. The flip side is it's made information more accessible, and it's made providers like myself, DNPs of color folks that are giving the good information, it's made it more accessible for people to get the information that they may not have been inspired to get information from. I mean, everyone has like their favorite people they like to follow because they know that they're going to either give them the truth or the real, like the real Theo Harvey, or, give them the information in bite size, understandable information that they can really take in that resonates for them to understand. Because a lot of times, and I'm guilty as a nurse practitioner, that medical jargon just kind of just rolls on out like a second language. And so you have to think about patients understanding that. And then we're in a society where those micro doses, micro learning really resonates. So social media is good for having that opportunity to get those bite-sized pieces so that you can understand and have access to the information.
I agree. I mean, I think the challenge with social media, everyone purports to be an expert, but they're not. And so, I have
Correct.
young children trying to form, we talked about this growing up, critical thinking skills, right? That's
Oof,
so much important. And what I always say, when you look at any kind of resource, consider the source, right? What's their
correct.
background? Where they're coming from? What's their intention? What they're
Mm,
communicating. So you have a influencer in there saying, hey, you should take this drug. Who are they, right? Are they a doctor? Do they have a saying? And number two, are they getting compensated for telling you this information, right?
that
And
part.
so, I think that's the challenge a lot of times when it comes to social media. And a lot of people don't, because it's so much, you get overwhelmed. You just, what they call doom scrolling. You don't really think about it, but and just awash with information, but taking a pause. He's okay. This is whatever reason, that speaker is speaking to you some way. But then you
Mhm.
have to do that next level of like, what's their intention? And then, what's their authority, right? To kind of talk
Yes.
to me before I really dive deep into their content, right? We don't get into politics too much on this podcast, but as
Good.
we know, there's going to be some changes coming in the healthcare
Listen.
organization
Oh
and
my
some of the
goodness.
leadership that's coming on board, right?
Yeah.
They've been clearly against some of the evidence-based studies around vaccines and other things. And I think that it could be a challenge, right? When it comes to
Mhm.
standing out. So when you talk about that, when you talk to other clinicians about like getting on social media and sharing expertise, what do you tell them, if they're like nervous about it? And to your point, the communication piece, right? They don't want to get in the jargon. What do you tell them? What 3 steps or a couple of steps did you guide them on to help them get on social media?
Yes, so I always tell folks, be authentic. So a lot of times people want to have certain personas on social media, which is fine. But I think that if you want to have a certain target audience, figure out what that target audience would want, and then you just develop your brand from there. And then just being consistent. A lot of folks want to come out the gate and just like, I want to post all the things. And it's like, you've got to take things one step at a time. But as long as you're being consistent, it'll allow you the opportunity to get that feedback on how you're being received. And then I'm always erring on the side of being authentic. It's like people want to know your story. People want to know that you're real and accessible. So find what your authentic voice is and just rock with that.
Mm-hmm. I think that's so true. And intentionality, like we had several doctors on here. Dr. Refi talked about like breathing exercises, especially during COVID, and he went viral. But his intention behind that was just to help people. I had a cardiologist, Dr. Isam, he talked about, he kept getting the same questions over and over again. So he used social media as like, here's the FAQ to help patients,
Nice.
and really help save lives, right? So they didn't kind of come back with the same questions over and over again. So I think that's so important with that. So as you talk to your DNPs and guiding them, on this professional journey, what do you tell them about technology? Obviously, AI, artificial intelligence, is a big buzzword. Using AI to help with clinical decision making, but also do administrative tasks like charting and things of that nature.
Mm-hmm.
What are you telling them? I mean, we're in this space. We use technology to kind of reach out patients remotely and guide them, to use blood pressure cuffs, at home. But as a clinician, what are your thoughts about technology, specifically AI, and the impact it can have as you treat patients and as you mentor other, DNPs in this space?
AI is something that has grown exponentially over the past year. And we're talking about it in our community that we're embracing it, but also taking initiative to make sure that we are being mindful of the flaws that it has, but using it as a supplement, but not a replacement for care of patients, looking up information and setting guidelines and stuff like that. So, and one of the things about folks that have their DNP degrees, we tend to be on the innovator side. And so we're looking at it as ways to help care be more efficient, effective, but also recognizing the imperfections with it. So we need to embrace it. And while we're embracing it, we get to write the ethics around it on best use, proper use, and how it can help us take care of patients and families better.
Mm-hmm. I love that. I think be on the cutting edge and understanding technology, not being afraid of it, right? Obviously, healthcare is built on literature and evidence base, and that takes time to develop, right? And I
Yes.
get that part because it's based on the scientific methodologies, right?
Mm-hmm.
Having a hypothesis, testing it out, judging it, having peer reviewed, literature to kind of understand if it's truthful or not.
Mm-hmm.
But technology kind of try to trumps all that, right? Said, hey, it works.
It
Let's
does.
use it. But so how do you marry the two, right? So that you
Right.
can use the technology to be forward thinking and advanced, but also realize that sometimes the technology could be incorrect, right?
Correct.
Because, I think that's always a challenge. I'm a technologist and a business person that came from that space and got into healthcare. And I realized, oh, wow, healthcare obviously is a little bit slower, but it's deservedly that way, right? Because we don't want to do things that hurt patients, right?
Oh,
Ultimately,
yeah.
right? Do no harm, right? That's always the
Mm-hmm.
first order of
Mm-hmm.
business. Whereas famously, technology said, move fast and break things. So it's like
Oh,
antithesis,
no.
right? Yeah, it's the antithesis of each other sometimes.
Yes.
And that could be a problem, right? Because even with social media, right, there's all these literature and studies coming out now that talk about the mental health that's happening on the youth,
Yes.
right, and stuff like that.
Yes.
So we just put it out there. I've seen the same thing with AI. There's just so many different things that are coming out now. What's the harm to patients? And one of them,
Mm-hmm.
the base level is just the misinformation that people don't know what the truth is, and
Mm-hmm.
not understanding how to use their critical thinking skills to get past some of those gatekeepers. So that could be
Mm-hmm.
a challenge. When you kind of look at like where you're doing in the space of like patient care, I know
Mm-hmm.
you're part of the American College of Chest Physicians. What's some advancements, when you think about technology or just patient care that's helping with critical care that excites you most about improving patient outcomes long term?
Yeah, so some of the technology things, and this may sound really basic, but it's a huge thing, is just being able to be more efficient with documenting and billing. So, with my healthcare institution, we're starting to look at utilizing AI to help us with populating our notes. And that is such a huge portion of our time is writing the notes, ensuring that the language is aligned with the billing and coding language and stuff. And so a large part that takes away from us being able to connect with our patients because it's like,
Mm,
yes, I see you. We're great. Anything wrong? Okay, I got to go write my notes because that is a huge burden in a provider's world and making sure that it's aligned so that we can get reimbursed. I just met with some technology folks about utilizing AI as a supplement to curbside for the latest evidence on managed treatment and management strategies for patients because sometimes when we're in clinical practice and if we have a question on the latest guidelines, we're going to certain things on the website which can be time consuming. But this AI that I was presented with was it presented all the latest evidence that you can choose which evidence that aligns with that care and management of that specific disease process, which will help to eliminate going to sitting down to your computer to get that in the moment curbside on the guidance to care for the patient. So I thought that was pretty cool. So I'm starting to see the incorporation of those type of guidances to help us with our clinical management.
I love that. Yeah, I think I've seen that where even with my own personal journey, being in with the physician, they have an MA or someone, documenting notes while they're talking to you so they can look at you face to face and look at your
Yes.
reactions. Because to your point, you can't be taking notes and try to talk to the patient at the same time. But if you have an AI tool, then, obviously that can be a little bit more efficient and maybe more accurate than maybe
Mhm.
human hosts could be. And I agree. Point of care, having access to knowledge when you need it is key. I think
Mhm.
another thing, obviously we're more on like the patient care side. So
Mhm.
compliance, medication compliance is big. Making
Oh
sure
gosh, yeah.
patients, get their readings, so they are. So for instance, we work with nephrologists and cardiologists. So blood pressure is a big thing, right? That's the tip of the spear for, as a lot of disease states, so hypertension,
Oh.
uncontrollable hypertension, and so simple things of taking your blood pressure pretty consistently can kind of help
Mhm.
manage that more effectively. So how do you keep patients compliant, right? Yes, you can send text messaging, but then can that be changed to kind of speak in their own language, right? Or their own,
Yes.
different multi-language modes,
Mhm.
or can
Mhm.
you guide them along what they said that was important to them, so they're reminded,
Mhm.
so they know why they're doing it, and they can be
Yep.
more consistent. Point of care, if they're doing their what time they're doing their reading, can someone reach out to them during that period of time so they
Mhm.
feel better connected? And so I agree.
Mhm.
I think using technology to kind of enhance the
Yes.
patient doctor channel. You talked about
Yes.
doing things that help you to speed of care, right? Which is
Mhm.
the reminding about the evidence-based studies out there, but
Mhm.
also connection, because now you're looking at the patient and not having to look away from them is
Mhm.
key. So that's kind of how I look at it. But thank you for kind of netting that out and high level for me as well.
Mhm.
So tell me a little bit more about DMPs of color and kind of
Mhm.
what are you guys working on? What's next for you guys? And talk a little bit more about your organization.
Yeah, absolutely. So DNPs of color, we were created from my experience of being the only Black woman pursuing a doctorate in nursing practice. And for those
Mm,
that don't know, a doctorate in nursing practice is a clinical terminal degree where it's the highest level of education in the nursing profession. And then nursing has two doctorates. We have the DNP and the PhD. The PhD degree tends to be more the nursing science research related terminal degree, and the DNP is the clinical practice. So a lot of us are still practicing clinicians or academicians from both doctorate degrees. But with DNPs of color, I identified that there was a gap in the professional organization space that focused on this specific growing body of nurses in the nursing profession. And with the DNP professionals, because we have the opportunity that we're still in practice and our education allows us to learn more about leadership, systems, policies, and procedures, and how to navigate organizational structures to advance care, it's kind of like the best of both worlds. You're still practicing, so you have that knowledge and understanding of what's going on in healthcare. And then you have the other knowledge, which helps you figure out how to navigate to bridge your clinical knowledge into not only practice, but into systems, policies, procedures to advance care for patients and communities. And so with our organization specifically, we're focused on nurses of color so that they have a space where they can learn more about how to really leverage their DNP degree, not only in clinical practice, but also executive leadership in the technology spaces and also in academia and so on and so forth. So we provide professional development programming and events. We provide mentorship opportunities and scholarship opportunities to provide any funding that might be needed for any other professional advancement, whether it be certification, conferences, or just for tuition support. A couple of initiatives that we do, we have a speaker series that allows subject matter experts that are either students, active professionals, to share some of their subject matter expertise. Like most professional organizations, we have an annual conference, which is our highlight of the year, where we all get a chance to connect and network and share our expertise. And then we have 2 mentorship programs, one that focuses on professionals transitioning their dissertation paper into manuscripts ready for publication. And the second one is going to be launched next year, but it's focused on developing how to be a mentor for DNP leaders. So we've got a lot of things popping, but we get the opportunity to brand what a DNP prepared nurse looks like and the contributions that they make into clinical practice. Because the brand, when you think about PhD, people have the understanding of what a PhD prepared nurse looks like. But when it comes to DNP, not so much. So we are one of 2 organizations that are focused specifically on DNP prepared nurses. And it's an exciting space that we get the opportunity to really leverage that to help shape the professionalism of the DNP prepared nurse.
I love it. I love it. Well, that's awesome. I mean, the passion you have for it, and, you take the pain of what, not so much the pain, but just, where you were, and he's like, hey, I need help. And then you made it more broad to help
Yes.
others. And so that's always about giving back. So, likewise, we work with so many independent practices, doctors that are
Yes.
struggling, trying to maneuver this new normal of healthcare. And so, we're just trying to give back as much of, and every little piece, experts like yourself that come in and share your expertise, that's helping another doctor, who's in a rural
Absolutely.
area, say, hey,
Yeah.
maybe I should go after this advanced degree. And so where can
Yes.
they find you, Dr. McCamey?
Yeah, so DNPs of Color, we're on all the social media platforms. So you can always just Google DNPs of Color. We're on Instagram, LinkedIn, Facebook. I was like, we even got a Pinterest account.
Love it.
And same with me. I'm on all the social medias as Dr. McCamey. So I'm always open to connect. I love networking and being of service in any way that I can. So please hit me up and find us on all the social media.
Awesome. Well, thank you for your time. I really appreciate it. Everyone, go find out more about DNPs of Color. Definitely take what she has to say about how you can build your social media presence and embracing technology for better patient care. Thank you again for listening. And look, check this out, our latest podcast on all the greatest things that's happening in healthcare, because we all try to adjust to this new normal. Thank you.